Coming up next, a condition called greater occipital nerve neuralgia. If you have trauma or some type of injury to the back of the skull, it could cause pain, numbness, and tingling that can be treated.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
I'm Dr. Carrasco.
I'm Dr. Alex De Jesus.
We're talking about painful conditions that affect many patients. And today we're talking about a patient, Alex, who came to see me, had pain to the back of her skull.
And was it on both sides or one side?
She had it on one side. Her history was that she had a window hit the back of her head when she was younger, but recently she's fallen and hit the back of her head several times.
So this is cumulative trauma, like a little bit, one hit, second hit. That's why the history is so important. We got to talk to our patients and see what's going on. How about if she was on the bed on her iPad all night long, kind of in this position? Would that do something like that?
Anything that puts pressure right on that area, a hard hat, a hit, laying on a hard surface, anything that does that can cause these symptoms. But this is a diagnosis that's made by history. If they give you that history with numbness and tingling going up to the head and pain, very likely that's what happened.
And so they need an MRI, a CAT scan, and an X-ray and all that stuff to diagnose?
No, you just buy a physical exam. I'll show you here in a little bit. Let me tell you what's happening with the body. Let me tell you what's happening with the nerves. This is the back of the skull, right in here. All these nerves come out of the spine, as you know, and then go up to supply all the parts of the skin. In this case, this greater occipital nerve, it comes out of here, travels up the back of the head, and supplies almost to the top of the head.
And there's one on the left and one on the right?
There's one on the left, one on the right, and she hit the one on the left. That's why the pain was there.
So for this condition, we expect it to be on one side, right? Not on both sides.
Exactly.
All right,
exactly.
all right.
And here's it. It can't happen on both. Usually it's a one-sided situation. Let's talk about treatment. What can be done for this situation? Let's sit right here for a second. Let me show what we have. What we do is put them on anti-inflammatory medications, right? Motrin, Advil, leave some of those medications. Sometimes anti-seizure medications to kind of decrease the irritability of the nerve, because the nerve is kind of being crushed. It's like a crush injury.
Okay.
Right? Whether it's in the foot or the hand or anywhere else, it's the same thing. It just happens to be in the skull.
Would you do ice packs and heat packs?
People did that initially, but it doesn't make a big difference because the nerve is irritated. So whenever that doesn't happen, then our options are to infiltrate the nerve with some steroids.
And so steroids are bad?
Well, these are good steroids. These aren't the bad kind of weightlifter type steroids, but they're steroids that will help decrease the inflammation, the irritability of the nerve.
So that's the power of the right treatment. Now, a pill may not even touch this pain, where a shot can actually get rid of it.
Right. So let's talk about the exam. That's what we do and how we do it. So here's how we do it. When we examine the patient, this is a bone here and another bone right in here. We go halfway between there, and that's kind of where the nerve comes out to supply the rest of the scalp. So what we tend to do is push on this area. If it causes pain, it very likely is coming from that nerve, right? So the treatment, we inject some steroids by simply taking a small needle with a little bit of steroids in it, and just kind of fan it right across here and inject all the way across, making sure that I get all the branches going over the area, and most of the time this pain is going to go away. Immediately after the injection, they'll feel numbness where they used to feel pain.
And so the patient's going to need how many injections? Just that one, or?
In my experience, once or twice, generally with a little bit of therapy, kind of work the muscles that are back there too, and this thing goes away.
So this patient's going to come back happy. He's going to come back without pain in a box of donuts.
That never happened yet, but if it does, we don't want to eat too many donuts, but we'll take the donuts.
Well, they're for the staff. They're never for us. They're for the staff.
Yeah, okay. So there you have it. If you have pain to the back of the skull, usually from pressure or trauma, you may have greater occipital nerve neuralgia. It can easily be treated. See your doctor.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.